Now we have various modalities where AI, robot, endoscope and microscope has completely disrupted the field of spine surgery. Myself, Dr. Kunal Singh, I'll be talking about future in spine surgery. Robotic spine surgery, where pedicle screw placement is very precise and it is very useful in deformity correction cases like scoliosis and kyphosis. Another is minimal invasive spine surgery with tubes and Macloc's retractor. Second most minimal invasive spine surgery is endoscopic, which is again divided in two types, that is monoportal and biportal. Monoportal has two, that is transforaminal and interlaminar. Biportal is UBE surgery. We have 3D printing for personalized and customized implant for patient-specific treatment. We have biologicals where stem cells and gene therapy help in regeneration of disc and delay the progression of degenerative spine disease. Another modality is artificial disc replacement, where the motion is preserved, unlike the conventional surgeries where we used to fuse it, where the motion of that particular segment was lost. Thank you.